What is a heart attack? The heart is a muscular organ found in many different species. It can be found inside your chest, closer to the left-hand side. The heart is responsible for pumping blood around your body. Blood flows from your body into the right atrium at the top of your heart. It then flows down into the right ventricle just below it. And finally, it flows out to your lungs where it picks up oxygen. On its way back from the lungs, your blood flows into the left atrium, and then down into the left ventricle just below it, and finally out the aorta and into the rest of your body. Your blood is what carries oxygen and nutrients to the different tissues that make up your body. It also removes their waste. But the heart is also a tissue, so how does it get blood? On the surface of the heart are the coronary arteries. These supply the muscles of the heart with oxygen and nutrients. If the blood supply to part of the heart is interrupted, this will cause a heart attack. The most common cause of heart attacks are from coronary heart disease, where fatty buildups called plaques form in the coronary arteries. This buildup can occur over many years. The plaques can eventually burst, and the blood clumps together, forming a blood clot. This blocks blood flow through the coronary arteries. If this is not treated quickly, the part of the heart fed by that vessel begins to die. A less common cause of heart attacks is a spasm or tightening of the coronary arteries. Likewise, this cuts off blood flow through these arteries. Heart attacks can lead to several other heart problems, like heart failure and arrhythmias. Heart failure is when the heart is unable to pump blood around your body to meet its demands. Arrhythmias are irregular heartbeats. They can be especially dangerous if they occur in the lower chambers of the heart, which you will remember are called the ventricles. If someone is experiencing a heart attack, there are many signs and symptoms that you can be on the lookout for. These include neck and jaw pain, arm pain, chest discomfort, usually on the left-hand side, and upper abdominal pain. The person may also experience lightheadedness, shortness of breath, and fainting, nausea, and fatigue. Chest discomfort can last for several minutes. It can go away and then come back again. It can feel like a pressure, squeezing, fullness, or pain. When a man experiences a heart attack, the signs are often very clear, whereas women often have much more subtle symptoms. The symptoms can vary person to person, and some people may not even realize that they have had a heart attack. If you think someone is having a heart attack, you should call emergency services right away. It is important to call an ambulance and not drive the person yourself. EMTs inside the ambulance can provide immediate treatment on the way to the hospital. The EMTs may give the person aspirin, oxygen, and pain relief. A fast response time is crucial to limit the damage and prevent further complications. So remember, the first thing you should do is dial 911. Upon arriving at the hospital, an electrocardiogram will be taken, also known as an ECG. An ECG is an electrical tracing of your heartbeats. There are some other tests at the hospital that may be performed. A blood test can be used to assess the damage done to the heart muscle during the attack. An echocardiogram is like an ultrasound of the heart. It uses sound waves to evaluate the heart's function. Coronary angiography uses dyes to map the blood vessels of the heart. It can be used to guide treatments of obstructed vessels using a balloon or a stent. The balloon in blue is used to flatten the plaques in the vessel, whereas the stent, the metal mesh, is used to hold the plaques against the wall to allow the blood to flow unobstructed. There are many ways to reduce your risk of heart attacks. First of all, do not begin to smoke or attempt to quit if you already do. Eat a healthy diet consisting of fruits, vegetables, and whole grains. Exercise daily. Also, maintaining a healthy weight is a very good idea.